so excited to get started here tonight. We have both our doctors ready to go. We see you're trickling in. We want to thank you for those of you that have continued to stay with us throughout all of this, as these parental guidance seminars have really been such a resource to get great information in a time when so much health information has been coming at all of us all the time. There we go. We've got our Dr. Lisa Gwynn. She is the Associate Professor of Clinical Pediatrics and Public Health Sciences at the University of Miami Miller School of Medicine. Beyond serving as Associate Professor of Clinical Pediatrics and Public Health Sciences at the University of Miami Miller School of Medicine and Interim Division Chief of Child and Adolescent Health, Dr. Gwynn is also the Medical Director for the Pediatric Mobile Unit, a program that offers a medical home to uninsured children, as well as Program Director for the School Health Initiative, 9 pediatric clinics in Miami-Dade County schools. She also leads a mobile community immunization program, as well as a pediatric COVID-19 testing team, which has tested over 15,000 children in Miami-Dade County. Dr. Gwynn is board certified in pediatrics, a fellow of the American Academy of Pediatrics, and the president of the Florida chapter of the American Association of Pediatrics. Dr. Gwynn remains steadfast in serving her community and is a passionate advocate for children, especially those in the most marginalized portions of our society. Dr. Gwynn, thank you for joining us. And alongside Dr. Gwynn, Dr. Brandon Chatani, Associate Professor of the Department of Pediatrics, Division of Pediatric Infectious Diseases, Holtz Children's Hospital, Associate Program Director of the Pediatric Infectious Disease Fellowship, University of Miami Miller School of Medicine. He is the Associate Program Director for the Pediatric Infectious Diseases Fellowship Training Program. He is a published researcher with ongoing projects on COVID-19 and viral infections among the pediatric transplant recipients. Beyond his practice of medicine, he's an advocate for the LGBTQ+ youth and homeless youth. From working to prevent transmittable diseases to establishing safe and stable housing, his vision has always been to direct evidence-based care to our most vulnerable youth. Thank you, doctors, for joining us. Thank you, audience, for joining us as we continue to talk COVID vaccines. We're still in this pandemic, and and both of you know that too well. It's hard to believe it's almost been 2.5 years since COVID became part of our everyday lives. We're going to start with Dr. Gwynn. Can you give us the big picture overview of where we are with the virus right now?
So we are still in the midst of a pandemic. We are on the, I would say we're on the flip side, in the sense that we now have vaccines in our tool chest to be able to fight this virus. The other positive recent event is that we now have vaccines all the way down to 6 months of age. So we are in a better situation than we were a year ago for children. I do want to point out that kids are still hospitalized for COVID. And as a matter of fact, over 50% of those children that are hospitalized currently are in the 0 to 4-year-old age range. So it's important that we recently were able to access those vaccines for the younger children, and we're looking forward to putting shots in arms.
Yeah, no, I know. And Dr. Chatani, I personally know several people who've gotten COVID recently. I'll put my hand up. I had another bout of COVID last week. Seems like we're in another surge. Is that the case? Is that what you doctors on the front lines are seeing?
Yes, we're going into another surge now. As new variants come about, we're going to see new surges come forth, especially in the unvaccinated. It really is continuing to be a pandemic that primarily affects those that are not vaccinated. So like Dr. Gwynn said, 50% of those children being hospitalized with COVID are in that age group that just now are available to be vaccinated. So more shots in arms is going to get us to where we get that number down to 0.
Yeah, and I personally have been vaccinated, not boosted, because every time I go to get boosted, unfortunately, I have another bout because, again, it's going out and about. Both of you specialize in children and the youth. Can you tell us a little bit about what you're seeing among your patient population. I just heard Dr. Gwynn say that she's seen children hospitalized. Is that the same thing you're seeing, Dr. Chatani?
Yes, there are still children being hospitalized for COVID-19. They have respiratory issues where they need support in breathing. Some of them have high fevers. They do not feel well, do not eat or drink well. We have also on the flip side, we still see a condition called MIS-C, the multi-inflammatory syndrome for children, where it affects you after you've been exposed to COVID. And they have where basically their body attacks itself, and they can have cardiac issue, heart issues, kidney issues. So there's still serious disease out in the community related to COVID-19.
Yeah, Dr. Gwynn, what are you seeing? What are you seeing about the kids that are being hospitalized? And a lot of people say pre-existing conditions, and a lot of times they're so small you don't know if they have a pre-existing condition or how anything is going to affect them.
Well, we're seeing a little bit of everything. Some children that do have pre-existing conditions, such as asthma, which is very common. But then we also see healthy children that become very sick. And the long-term effects of COVID are still relatively unknown. So just as in adults, it's still not clear how the virus impacts the different organ systems long-term. We have that same situation in children. And so it's, I think there's this false narrative out there that COVID doesn't affect kids as bad as adults, maybe from a numbers perspective, but those kids that do get severely ill, they get severely ill, and some of them do end up with long-term effects. And so as a parent, I wouldn't want that to happen to my child when it's preventable. And so that's why we're encouraging children all the way down to the age of 6 months to get vaccinated.
Can we expect COVID to stick around and it's going to be like getting a flu shot every year? What are we hearing? What is the latest research telling us?
So it still sounds like it can become seasonal in the long run, but as we said, we're still in pandemic mode. So because there's so many cases currently out there, the vaccine is recommended to fit that bill so that we can prevent it with the high amount of the virus that's there in the community. As it fades further away into the background, we'll see where maybe vaccine recommendations change slightly. But right now, we need to get shots into arms to be able to get to that stage.
Yeah, the CDC and the FDA recently approved COVID vaccines for kids as young as 6 months. This is the unvaccinated population, 6 months to 5 years we had up until this point. Do you recommend the vaccine for this younger population? And what do we know? Everybody always wants to know about the research that went into making this vaccine for these children.
Well,
So
definitely. Yes, go ahead.
I absolutely recommend the vaccine.
Yes.
Let's make that absolutely clear. As a pediatric infectious disease expert, this is my field, and I recommend the vaccine down to 6 months. The reason is both Pfizer and Moderna stepped up to the plate and provided us with really good research backing up both efficacy and safety for their vaccine series. And they thousands of children in each trial, and they're not the same kids in both trials. They're different sets of children, and they're from all over the nation, from all different ethnicities and racial backgrounds. So we know that this research is shown to be highly effective and to be very safe. They focused very greatly on safety. And when they saw that any blips, any markers that there may be a concern, research was rolled back. And that's why the timeline got delayed. And that's them doing their due diligence. That's them making sure that the product that is put out there right now and we're putting into arms is the safest and most effective that we can do.
And I echo those sentiments exactly. And as a general pediatrician, I have to have those conversations with parents, in terms of the risks and the benefits for their child. And there is some hesitation out there. There was hesitation in the 5 to 11 age range, and we are starting to see some hesitation in the younger age groups as well. But what we try to explain to parents is, of course, you have to ultimately make that decision for your child, but stay focused on the science, stay focused on the medical advice that your pediatrician gives you, because there's a lot of noise out there. There's a lot of misinformation out there. Unfortunately, this vaccine has been politicized, and we have to fight that and provide our parents with the best information to be able to make the right decision for their child.
Yeah, and some of the first questions are coming in about those politics. But Dr. Gwynn, since you really do a lot of outreach into our outer communities, the hard to reach communities with your mobile units. The vaccine doesn't, to a child, the small children, don't only protect the children, but also a lot of times the elder caregivers that may be handling these children.
Yes, and this is something that we also want to talk about, is that yes, it protects the child, but it also protects the extended family members. And this pandemic has become so much more than just the health part. It's the child care, it's the children going back to school, it's the parents missing work. All of these things play a factor in our ability, the reasons why parents choose to get the vaccine. So yes, for the most part, 100% we should do it for the safety and protection for the children's health, but also extended family members, and also to keep kids in school and to keep parents working so that, we can get back to a normal life like we also desperately want.
All right, our audience is weighing in. They want to know, where can they get the vaccines? Because there was so much talk about it not being ordered to the state of Florida. Do our pediatricians have to special order it if we want it? Can we go to a center? Will Publix be administering it? What's the truth? What's the reality out there, doctors? Where do we get it?
Well, just the other day, we had a vaccine drive here at Jackson and Holds with the pediatric mobile unit, providing these vaccines available to the community. Yes, your pediatricians do have access to it. Again, a lot of the noise out there is people playing politics, but know that it's accessible. Talk to your pediatrician. They'll know your community the best and know where you can access it the best. There are a lot of resources that will also show at the end of this webinar of places you can look for. Lots of great search engines out there of where you're going to be able to find it.
How many shots?
Go ahead. Okay, go ahead. I'm sorry. I do want to mention the fact that this vaccine for the younger age group has been handled differently by our state leadership. And unfortunately, the local health departments are not going to be receiving the vaccine for the under 5. And so what that means is that children that don't, that don't have a medical home, or that don't have health insurance that normally access vaccines through their local health departments, will no longer be able to do that for the younger age groups. If you're over 5, you can get the vaccine. And also pediatricians that may have gotten their vaccine from their local health departments instead of ordering it through the state, they no longer will be able to obtain those vaccines through their local health departments. So on the advocacy front, we're trying very hard to press upon state leadership that this is a problem. This is a health equity issue. And so hopefully minds will be changed and we will be able to have better access to the vaccine for everyone.
Absolutely. How many shots are in this vaccine series for the children, Dr. Gwynn?
So it depends on which manufacturer. So the Moderna vaccine is a 2-dose series, and the Pfizer vaccine is a 3-dose series.
Wow. What are they? How are they spaced?
I believe they're 3, 2. They're both a little different. We're still learning about both the vaccines, but I want to say it's a 4-week minimum window from the first to the second. And Dr. Chatani, yeah, correct me if I'm wrong. And both have different storage requirements. It is a little confusing. We have different labels for each age range, different colors, different numbers of boosters that you need depending on the age range. So it does take a little bit of time for our nursing staff to kind of get it all together, but we're ready to do it. We're prepared. And actually this week we started in our mobile clinics putting shots in arms, and it's been going very, very well.
Dr. Chatani, anything to add?
Yeah, so just to clarify, the also for this particular age group that we're talking about, it is a different amount of the product that's there in the vaccine. So when the research was done, a good comparison to have in mind is that an adult, let's say the number was 30, is going to receive 30 parts of what's inside the vaccine. Whereas a child, that next age group down to 5, gets 10. And then the youngest age that we're now introducing gets only 3. So very, very smaller amounts that we're talking about. And so for example, Pfizer is that 3 that I'm referencing. And so it requires an extra dose in the series to get the response that we want, that you want. You want your child to have a response to this vaccine so that they're protected. And then the Moderna is 2, but the Moderna uses a slightly higher dose and a different scale. So those are the primary differences between the 2 manufacturers. Yes, it's about 28 days between the doses.
Wow. What are some of the short-term symptoms for babies and young children receiving the vaccine?
So far we've seen similar side effects to other vaccines. You know, some babies and children don't have any response or any reaction. Some will have a mild fever. Some who can complain about a sore arm will say that their arm hurts a little bit. But for the most part, we haven't seen anything serious. So yeah, it's so far so good.
Yeah, and to be mindful, we have in the United States a vaccine adverse reaction network where these kinds of things are reported. And if enough are reported, it gets elevated and we're all notified. Every doctor, especially in the ID community, we get notified of what is going on and whether or not our recommendations should change. For these, from the studies that they did, it was mostly mild fever, some fussiness, maybe a little decreased eating for a day, and then it was over and fine.
Mhm.
Right. People are still asking, you know, I mean, their pediatricians have not received the vaccine. What do you know about individual pediatricians? And you may have answered this before, but when can they expect to get it? You know, I know, Dr. Gwynn, you were talking about health equity and people being able to access it.
Right. If you have that medical home and you have that pediatrician, it just depends on when they ordered it and when they're able to put in that requisition for them to receive it and exactly what methods that they go about doing it. Right. The Department of Health is not going to be the source for this age group.
Yeah. Will getting the vaccine prevent the children from all the variants? What do we know? Because we do know that in all cases, even though a lot of us who are vaccinated are still getting COVID, we're not being seriously hospitalized. Is that the same for children?
That's exactly right. So there are 3 things that they study when we study efficacy. When we say the word efficacy, we're talking about what does the vaccine prevent? 3 categories: infection, hospitalization, and death, basically. And we know that regardless of the variant, that we've maintained good efficacy against hospitalization and death. Infection still happens. You still can test COVID positive after having received the vaccine. But you're less infectious, even though you've tested positive. Remember, the test is very sensitive to detect whether or not you have that infection. But you're less likely to pass it on because your body is there actively fighting it. And that's a first mode of defense before it passes on to another person. And then equally, because you have that defense that's there, it's not going to get so seated in your system that it causes severe infection that would lead to hospitalization.
Thank you, Dr. Chatani. Dr. Gwynn, if my child has had COVID, what is the recommendation on how long they should wait to get vaccinated?
Well, you know, there's a lot of misinformation out there, and we recommend that as soon as your child is better and completely symptom-free, it's okay to go ahead and get the vaccine. I don't know, Dr. Chatani, if you've heard anything different, but that's
I know the information
yeah.
before was waiting 30 days after infection. But if you factor in how long it takes them to get better, when you're able to schedule appointment and what have you, it may take that long. They are shortening that time period though, where you can go sooner. If you're immunocompromised, if your child has other conditions, you should talk with your pediatrician because it may be a little case specific for you or for your child.
Yeah, let's talk boosters. Our kids going to have to get boosters.
So there
Yes.
is the approval for boosters now. From early June, we had the approval down to 5 to receive a booster if they have not, from their primary series, 6 months from their primary series is when they can receive one of those boosters.
Wow. Many people are still very nervous about getting their kids vaccinated. They'll sit here, they'll listen to the information. Where can they go to find information on their own? What do you recommend?
Well, I think one of the most, the standard of practice is, of course, the American Academy of Pediatrics, AAP.org. They have a section called healthychildren.org, and it goes through all of the different questions, FAQs, information about the vaccine, about the virus, resources. So that's the primary resource that I would recommend. Of course, the CDC has amazing resources as well. I've never seen their website look so comprehensive and well organized. Dr. Chatani, I don't know if there's any others that you would like to add, but those are my
There's the Infectious
top 2.
Disease Society of America, which is our gold standard. So if you want all the latest nitty-gritty details of research, the Infectious Disease Society of America there has a webpage dedicated to summarize all of the literature that is out there, all of it. I mean, all of it.
All of it,
But
yes.
not everybody like me likes to read, wake up and read a good article on COVID-19 vaccination. So instead, yes, the AAP and the CDC summarize this even further to really break it down so that you can understand what the current recommendations are.
And we, of course, will have a list of resources in the graphic at the end of this webinar. One of the things that I really appreciated during this pandemic is how the world of doctors came together to really work on this together and share information. Are other countries vaccinating all kids from 6 months and up? What are we seeing worldwide?
Yes, I mean, we don't seem to have this hesitancy or politicization of vaccines in other parts of the world like we do here in this country. As a matter of fact, there's countries that still don't have access to the vaccine like we do, So, it depends on what part of the world you live in as far as which vaccines are available. There are vaccines on the market that we've never even heard of, that of course come from manufacturers that may be, American based or maybe European based, but it varies all throughout the world. But I can tell you that those underdeveloped countries definitely would rather be in the situation that we're in, having this plentiful amount of vaccines. To be able to have the privilege to not take a life-saving vaccine is something that they have never experienced.
Yeah, my colleagues in China, they have attested to that. They've started vaccinating down to that age group.
No, I mean, if a young, in the mobile clinics, are you vaccinating all ages from 6 months all the way up to 18? Because people are like, what if I have a little one? What if I have an older one? And they realize that this pandemic is not going anywhere.
So yes, actually, before the vaccine was approved for children, we were vaccinating adults. So the state of Florida, they funded our program to go out into the community and provide the vaccine for adults, and also, of course, COVID-19 testing for adults and children. And so as the age groups, have the vaccine has been approved for the various age groups, we've been offering it out in the community pretty much within days after it's been approved.
Yeah, and
Have you guys been seeing
go
ahead.
And
Go ahead,
you touched on like the community of doctors. It just made me think of, we have our own community here in Florida of doctors with the Florida chapter of the AAP. And so if your pediatrician, for whatever reason, is unsure of how to order it or where to get it from, reach out to the chapter. We are here with experts ready to help any community provider, family medicine or pediatrician, to be able to provide that service for these children.
Yeah, and what I like about where we're positioned in the world, you guys often funnel information into Latin America and the Caribbean, and you really do serve as a global resource for the region. Are we seeing the flu? I mean, we've seen so much, we talk about COVID. I mean, how do are you seeing the cold? Where'd the flu and the cold go?
No, they're back. Everything's
back.
back. You know, when the mask mandates were lifted, everything came back. And so now we're seeing, you know, unseasonal things that normally certain viruses and bacteria have this, you know, peak and ebb cycle within this, you know, they're seasonal, if you will. There have been times when these things have appeared that are out of season. And so, yes, kids are getting sick with all the other things that they used to get sick from, and then add to it COVID. So, yes.
Yeah, I'm seeing lots of influenza, lots of adenovirus, lots of RSV. I'll tell you, RSV is usually that wintertime virus. I don't commonly see little ones with bronchiolitis coming in, and we have them now, and they are there. This is unseasonably early for this virus. And yes, it's partly that we took off masks, and here they are.
Yeah. Ramon's asking about where the public can access details when these vaccines are being administered publicly in these community outreach events. We'll put that in the information with graphics at the end. People are also asking about, they have children that are being vaccinated back to school. They're common vaccines. What's the timeline for integrating a COVID vaccine into what you normally have to give your kids?
It's a great question. So there's no interaction.
Yes, anytime.
It makes it super simple. They studied it very well, looking at the common childhood vaccines, whether it's pneumococcal vaccine, the MMR vaccine, chickenpox vaccine, it's all okay. You can get them. Fine.
So our pediatric mobile clinic is going to be participating in back to school community events, some of which are sponsored by the Children's Trust. So that is another really good local resource, the Children's Trust. They have all kinds of events throughout the summer, and we will be participating in providing physicals and immunizations, both the childhood vaccinations as well as COVID. Also, Miami-Dade County has immunization events for the COVID-19 down to infants. So check the Miami-Dade County website as well.
Yes, all great resources. The Children's Trust really does start doing their back to school drive soon. How long does immunity or the greatest protection against the virus take to kick in after vaccination as it's received by babies? Is it still the standard 2 weeks like it is for adults?
Yeah, 2 weeks after the final dose is when you'll see the change.
And that's why it's so important to get your boosters. And this is one of the things that we learned with only giving a 2-dose series, is that the immunity was just not quite enough for the Pfizer. So that's why they had to give that 3rd dose to really prime the immune system to create a robust response to be able to provide that protection necessary for, against infection.
Right.
Dr. Gwynn, you talked a lot about mask wear. You talked a little on mask wearing, and that is still a contentious issue. I would put on those school board meetings and hear people screaming at the top of their lungs. What do we know about mask wearing as it affects our children psychologically?
There has been no evidence indicating that mask wearing is harmful to children, nor is it medically harm, not either psychologically or medically. This has been just an awful situation for parents, for teachers, for kids that go to school with their parents telling them they have to wear a mask, and they get to school and their friend says, my mom says I don't have to wear a mask. So it's been really, really challenging. And unfortunately, we all have mask fatigue. We all have COVID fatigue, but we still need to wear masks when there is a concern of either infecting someone else or someone infecting you. And so, it's still an issue for us.
And now kids are in summer camps. They're in summer camps, they're doing sports, they're doing everything. What precautions, in addition to being vaccinated, should parents be taking to make sure their kids stay COVID-free and safe? I mean, what kind of protocols should they look for at their camps, at their, their Bible school retreats, whatever they're doing during the summer, amusement parks?
So if it's outside, you're pretty safe, right? If you're outside and you're maintaining distance, then you're going to be in a pretty good in a situation compared to being in a closed space for a long period of time with a crowded room. That's kind of the worst case scenario. In the worst case scenario, I mean, wearing a mask and having good hand hygiene will prevent a great hope, not only COVID, but many of these other viruses that we've talked about today. So those age-old things that we've been talking about this entire pandemic still hold true for, make it make sense for your kid, and keep them safe.
Yeah. People are still asking about the difference between the Pfizer and the Moderna vaccine for younger kids. How do you choose as a parent?
That's a great question, and it's a fair question to talk with your pediatrician about, and weigh the evidence of, oh well, my kid has this particular condition. Was it included in one study or the other? I will say that for me, I look at a little bit of efficacy and not so much convenience, because the Moderna is going to come with a little more convenience of the 2 doses. The Pfizer, although it has 3 doses, did boast a little higher of an efficacy in their original studies. So those kinds of things have to be weighed in, and I voice that it's between the pediatrician and the parent to make the best decision for their child.
I will also add that both vaccines are the same mechanism of action. In other words, they're messenger RNA vaccines. So they're similar in terms of the delivery of the antigen into the body to produce a response. So, we in pediatrics, we've never really had this issue where we talk about the manufacturers of vaccines that we give to kids. When you get your MMR, do you know who it comes from? No, I mean, we've got all kinds of different brands and versions, and we just know that we're going to be protecting against measles. So I caution parents to get too picky, because especially in the younger age group where, it may be supplies may be limited in your specific pediatrician's office. Either one is fine. It's just get one of them. Don't shop around, if you will, and turn your nose up to the opportunity, because you may not get another opportunity. So that's my take on it.
Yeah. Another question about masks. What is the appropriate age for toddlers to start wearing masks, and can masks help protect the child against RSV and adenovirus in the daycare center?
So those 2 viruses transmit slightly different from one another. So RSV is a contact-based virus. It lives on very large droplets and lives on surfaces for longer than adenovirus. Adenovirus, on the other hand, is transmitted very similar to COVID in that it's aerosolized, maybe not as small of the droplets. So it does require that cough and sneeze to be spread in several ways. For safety of mask wearing, there are ages that are talked about down to 2, depending on how they're going to tolerate it and what their behavior, what their developmental stage is at, if they're going to be okay wearing it. Again, no detriment to doing otherwise.
Right. No, all great stuff. To date, you said you guys have had some really positive vaccination events out there. To date, what have you, how many kids have you vaccinated? And, you have access to all the supplies. There's no shortage.
Well, we just started vaccinating the little ones. It's just this week. So we've probably vaccinated maybe 50 babies so far this week. The older age ranges, we started really, really strong, and it's tapered down, quite a bit. Initially everybody was gung-ho with it, and those parents that wanted to get their kids vaccinated came out right away, and then it's kind of gone down from there. But I would say we've, since the pandemic, we've administered probably at least 5,000 COVID vaccines since they've been available to kids.
Yeah. We've been so COVID conscious over the last couple of years. Are there any things that you see parents ignoring because they are so concerned about this pandemic? I know in the adult population, there's so many things that we've neglected to do because of COVID. What about our parents coming to get their regular vaccines and doing all their regular upkeep for their children?
Actually, that was a big problem in the very beginning, that regular childhood vaccination rates were going down significantly. And, since kids have been able to go back into their pediatrician's office, the vaccination rates are rising. But, in the underserved communities, in certain zip codes within Miami-Dade County, we still have a challenge with vaccination rates for the regular childhood vaccines. And our vaccination unit called Shots to Go, it goes specifically into schools and provides those needed vaccines that are required for school entry. So we're still at it every single day. There's still thousands of kids that do need their boosters and to get them caught up on their vaccine series.
Yeah, and to tag on to that, because we had the drop in the number of children being vaccinated, I speak with my colleagues across Florida in infectious diseases, and we see that there is an increased incidence of some of these diseases that we prevent. We see a lot more pneumococcus, pneumonia, and invasive disease associated with pneumococcus than we did before. And that could be related to the drop in vaccine rates that happened here in Florida.
And as we know, those can be very, very serious illnesses to contend with, especially in young children. And for folks viewing this webinar, you can find a list of all the events in the chat. They click where the pediatric mobile unit clinic will be, and we put it right there in the chat, so you can go out and see Dr. Gwynn in person. Go out and say hello as she continues to do her work around the county. What else would you like to add as we, 2.5 years into this pandemic, still dealing with so many of the basic questions that we had in the beginning? But of course, when it comes to really young children, parents are always super. Now, when we're talking about children that are 6 months, what if the mother got vaccinated? Is it something where does that carry on into a young child to protect a young child up until a certain age?
Well, 6 months is kind of the age where maternal antibodies start waning. So yes, babies, especially if they're carried to term, which is another issue, preterm infants are much at higher risk because they don't get that deposit of maternal antibody that other kids, like full-term kids, get. But even for the full-term kids, the antibodies that mommies give them are not going to last forever, and they're not going to be at high enough level to really protect against some of the serious diseases that we're seeing. So that's why this vaccine is recommended at the ages that it's recommended.
And this is extremely important for, families that have more than one child, right? So think about the scenario where you might have a newborn infant that maybe mom wasn't vaccinated, but they have a 3-year-old sibling who goes to daycare and hasn't been vaccinated, comes home and gives the whole family COVID, and then the newborn gets very, very sick. And so this is really spans, again, we're talking about families and, protection of entire family members. This starts from the time that the mom is pregnant. And we know that pregnant women are at increased risk for complications from the virus. So immunizing pregnant women, making sure that the babies, once they're 6 months old and their immunity, runs out, that we go ahead and we give them the vaccination and continue to do so with all members of the family, even our senior citizens who need their second boosters.
Yeah, I want to point out that.
Yeah,
sorry. No, I want to point out that a pertinent point of talking about this particular age group, I'm sure many people out there have heard of all the different treatments. They're like, oh, if I get COVID, I can just go to the hospital and get treated. For this particular age group, there is only one medication available to get treated, and you have to get it IV. It has to be in a hospital, and it has many side effects, 10 times worse than anything that could possibly happen with the vaccine. That medication is how well it's working is kind of waning with the different variants. So I don't know how much longer that one medicine is going to be available for small children. So really, our primary tool here is going to be vaccination and having their own immune system fight this virus.
I mean, that is such a good point. In the beginning, I got the monoclonal antibodies, and that was readily available. And now it's not as readily available out in the community. And you're right, there's not a lot to treat small children. So the vaccine is really the best defense that we have. There's such folks weighing in asking about different appointments. Again, we're going to put all those resources up at the end. I feel like I'm reading a dead horse, but when is this pandemic going to be over? When is it gonna be over?
Somebody sounds like they're over it.
No, I mean, it's just, I think we're all over it. I mean, I
we
really
are.
feel for
We
our
are.
healthcare workers. You guys continue to be exposed and, trying to take care of your own families. You have had no break.
Yes,
No,
and it's
no.
evolved, hasn't it? I mean, it never seems to end. There's always something else that, that creeps up on us that we don't know about. But we speculate that it's going to be very similar to like the flu and these other, viruses that are floating out there. There is a serious talk and action taking place behind the scenes to revamp the vaccine, to reformulate it, if you will, so that it will be, mount a stronger response to these variants. So that's in the works. And they say that by the fall, adults will be able to have that new COVID vaccine, available to them later on in the fall, early winter. So, but that doesn't really, kids, we're just now getting the first vaccine for kids. So we don't see that happening, anytime in the near future. But yeah, I don't have a crystal ball. It's just going to continue to evolve.
No, mine's still in the shop, so I don't have that just yet. But it's going to be community action. Like for us to get there, the way that we eradicated smallpox, and if you don't know what smallpox is, great history lesson to look and see what vaccines can do. You don't see smallpox now because we vaccinated people and it's gone, eradicated.
Yeah.
So now it needs community action. There are a lot more people in the world now. But we have access here in the United States. We need to take advantage, leverage that access to really protect our communities and stamp this out. If you're tired of it, get vaccinated, get your kids vaccinated. That's how we're going to end it.
Yeah. Well, on the flip side, I mean, I think that people have come to appreciate the resources we have here in this community. I always tell people, I was like, and Jackson is on the cutting edge. They not only keep track of what's going on in our country, but other countries, and everybody else comes to study there. So I know that I'm safe when I have you guys on here and you guys on the job. But any closing thoughts? Any closing thoughts as we wrap up this session? Dr. Chatani, and then we'll go to Dr. Gwynn.
I would say my closing thoughts are, based on that community action, we need to gear up our communities to going out and getting vaccinated. That's how we stop this pandemic. The other thing that I like to tag on to there is that I know there's a lot of information out there. It's highly politicized, and there are a lot of places you could go for information. I'll tell you, Facebook and Google are not the places to go. Trust your doctors. Go to your pediatrician. Go to the national societies where thousands upon thousands of doctors are involved to get your information from the source, the people that are doing the research, those of us that have studied this extensively, so that you know what's really happening. Go there, and we're here for you if you need.
I couldn't have said it better myself, Dr. Chatani. And I feel as though let's do what's best for our kids. Let's not focus on the politics or the rhetoric that's out there, the misinformation that's out there. Let's stay focused on the science, on the facts, and listen to those in the medical community that have studied medicine for a long, long time, the scientists, the pharmacists, all of the people that have been so committed to making sure that this vaccine rolled out in a record time. It is, vaccines are one of the biggest public health accomplishments of all time. And I have to say the COVID vaccine in particular, and the rollout as quickly as it was, is really just unbelievable. And it's one of our proudest moments in science. And so let's lean into that and again, do what's best for our kids.
Yes, and I hope all these kids are in their science classes going, we see how important our healthcare workers are, and they look up to you. Dr. Chatani and Dr. Gwynn, thank you so much once again. And we appreciate all the work you're doing on the front lines. And of course, everyone who supports you and all the work there at and Jackson Health. Thank you for joining us. For everyone on this webinar, spread the good news, the information that you get here. Again, we put up all our information right here on jacksonevents.org. All these webinars are recorded there. Join us in 2 weeks we're going to do a screen time. Here are all our resources. At our expertkidscare.org, additional resources. Again, as you heard the doctors say, American Academy of Pediatrics, AAP.org, Health Children by the American Academy of Pediatrics, healthychildren.org, and of course the CDC. For more video tips and resources, jacksonevents.org. And this topic coming up on July 14th, it's a hot topic with every parent, everybody. It talks about what we're talking about as it pertains to children, screen time and social media. It's being associated with a number of health issues, especially mental health issues. It can also have a negative impact on your child's sleep and development. Once your child is old enough to have their own phone and gain access to social media, they face an increased risk of depression, anxiety, feelings of loneliness, and inadequacy. We're going to deal with all of that. Join us on Thursday, July 14th at 8 o'clock to learn when it is developmentally acceptable to introduce screens to your kids, strategies to limit your child's exposure to digital devices, and how to navigate your child's life on and exposure to social media. Keep in mind, the people that invented this social media don't give their kids devices. That's all I'm saying. That's the only thing I'm saying. But you can Google that. It is the truth. They developed it. Your kids are watching it. Their kids are not watching it. Just saying. And again, recordings of all parental guidance webinars, as well as downloadable tips and resources, always be found on jacksonevents.org, where you could sign up. Again, it is always an amazing privilege to be able to sit here, and I feel like it's my own private session. I get all this information, but I'm glad that everybody else has joined here with me. Stay safe, everyone. Wear your mask, get vaccinated, and get some sleep. Sleep is really important. Have a good night, everyone.